5 new cases of COVID-19 positive have been reported in Nagaland during the last 24 hours, taking the total number of cases in the state to 127. State's Health and Family Welfare Minister informs that 4 from Dimapur and 1 from Kohima quarantine centers out of the 333 samples have tested positive. Nagaland's tally of active cases now stand at 119 as 8 persons have recovered. The special train from Ahmedabad carrying stranded Naga citizens from Gujarat and Maharashtra arrives Dimapur in the wee hours of Tuesday morning. The passengers were received at the Dimapur railway station by Team Dimapur and all the nodal officers of the districts of Nagaland. The returnees are segregated district-wise and ferried by buses to the respective district headquarters. And the death toll due to COVID-19 rise to 7,466 in India, while the number of cases climbed to 2,66,598. According to the Health Ministry, the number of active novel coronavirus cases stand at 1,29,917, while 1,29,214 people have recovered. Well, hello and welcome to News and Trends, and you're watching the daily news broadcast. 5 new cases of COVID-19 positive have been reported in Nagaland during the last 24 hours, taking the total number of cases in the state to 127. Informing this in a tweet this morning, Health and Family Welfare Minister Pang Yupom said 5 new cases of COVID-19 positive have been reported out of 333 samples tested. 4 from Dimapur Quarantine Center and 1 from Kohima Quarantine Center. Nagaland's tally of active cases now stands at 119 as 8 persons have recovered out of the 127 cases reported in the state till this morning. With 4 more positive cases of coronavirus added to its tally, Dimapur has 100 positive cases, Kohima has 21, Twengsang has 5 and 1 patient is in Perin. The special train from Ahmedabad carrying stranded Naga citizens from Gujarat and Maharashtra arrived Dimapur in the wee hours of Tuesday morning. The passengers were received at the Dimapur railway station by APC and Dimapur in charge of COVID-19 Waiketo Sema and Team Dimapur. All the nodal officers of the districts of Nagaland were also present at the railway station to receive the stranded persons. We have this report. A special train carrying people of Nagaland who were stranded due to COVID-19 pandemic from Gujarat and Maharashtra arrived Dimapur railway station at around 1 this morning. The passengers comprised of 357 from Dimapur, 91 from Twengsang, 73 from Mon, 9 from Longlen, 45 from Kifri, 63 from Thek, 57 from Zunaboto, 41 from Mogokchong, 41 from Woka, 67 from Perin and 89 from Kohima. They were received at the railway station by APC and in Dimapur in charge of COVID-19 Waiketo Sema, Secretary Food and Civil Supplies Honjay Konyak, DC Dimapur Anup Kinchi, Commissioner of Police Dimapur Rotihu Tetsio, CMO Dimapur Dr. Tia Senap and other government officials. Returnees from Dimapur district were transported at Agri Expo site, which was followed by filling up of forms and medical screening before sending them to the designated quarantine centers. Returnees from the rest of the districts underwent thermal screening at the railway station Dimapur and were transported in the respective districts after giving food packets and bottles of water.
Kohimate, Ponchatante, Amikhan Dimapur Manu Laga Salam Dangur Janai Dibi. Apnikhan Geri Kurigena Kohima Manu Las Kuretu Moon Manu Tongsang Manu Longlen Manu Pek Manu Kipere Manu Zinyaboto Mukuk Chungkanto आगे दे जाइले पे अपनी खान आगे पुंची लोगों कोई जना अभी खाने का बनाए लक्ष्य
Prior to the arrival of the strain, APC and Dimapur in charge for COVID-19, while Kikheto Sema said that the team Dimapur is still going strong and they will deliver to the people and the government what was expected from them. He urged the people to remember him and his team during their prayers.
On the basis of the destination, we have planned out in such a way that after Dimapur it will be Tongsang, followed by Moon, and followed by Longland, Kipere, and so on and so forth. We are so glad that all the team are still strong and we will be able to tackle this situation. We would like to request everyone to remember us in your prayer, and so that we will continue to deliver the materials as expected of us from the government and from the people. Yes, it is hard, but hard is not impossible. We are going to tackle it.
The death toll due to COVID-19 rose to 7,466 in India, while the number of cases climbed to 266,598 after the country registered 266 fatalities and a record single-day spike of 9,987 till this morning, according to the Union Health Ministry. India is the fifth worst hit nation by the COVID-19 pandemic after the United States, Brazil, Russia, and the United Kingdom, according to the Johns Hopkins University data. The number of active novel coronavirus cases stand at 1,29,917, while 1,29,214 people have recovered and one patient has migrated, the ministry data said. Thus, 48.47% patients have recovered so far, the ministry added. The highest number of confirmed cases in the country are from Maharashtra at 88,528, followed by Tamil Nadu at 33,229, Delhi at 29,943, and Gujarat at 20,545, according to the Health Ministry's data updated in the morning. In the northeast, Assam has 2,776 cases, Tripura has 838, Manipur has 272 cases, Nagaland has reported 127 cases till now, Arunachal Pradesh has 51, Mizoram has 42, Meghalaya has 36, and Sikkim has reported 7 cases till now. The total number of global coronavirus cases has climbed to 71,20,678, while the death toll has reached 4,06,563, according to the Johns Hopkins University. With 19,61,185 confirmed cases and 1,11,007 deaths, the United States currently accounts for the highest number of infections and fatalities in the world. In terms of cases, Brazil comes in the second place with 7,07,412 infections. This was followed by Russia with 4,76,043, the United Kingdom with 2,88,834, India has 2,66,598, the CSSE figures showed. Regarding fatalities, the United Kingdom continues in the second position after the US with 40,680 COVID-19 deaths, which also accounts for the highest fatalities in Europe. The other countries with over 10,000 deaths are Brazil, Italy, France, Spain, and Mexico. SP Crime and PRO of Nagaland Police Manoj Kumar A has informed that the main accused in cybercrime Pankaj Gupta, who has been on the run from police for last several days, was arrested this morning from Kurukshetra, Haryana by a team of Haryana Police and Nagaland Police officers. According to DIPR, the arrest was effected based on the known bailable warrant of arrest issued by Judicial Magistrate First Class Kohima. The Cybercrime PS of Nagaland Police had taken cognizance of various social media trolls uploaded on various platforms by the accused, which were inflammatory, abusive, divisive, and prejudicial to the maintenance of social peace and harmony attracting the provisions of IPC, which are cognizable and non-bailable. The accused had made serious allegations without basis and authentication, along with conspiracy theories, which are a threat to public peace and order. It stated that the accused is being processed for transit remand and shall be produced before the Honorable Court, Kohima. It was further added that the police shall be investigating into the involvement of other co-conspirators on various social media platforms, if any, in furtherance of this criminal act. Nagaland Police, through the PRO, has appealed to the citizens of Nagaland to be cautious and discreet in soliciting comments in social media without verifying facts. The freedom of speech in a democracy also comes with reasonable legal restrictions and asks the citizens to be mindful of it. Nagaland Police has also stated that any violation of law shall be strictly dealt with as per the provisions of law and sought the cooperation of one and all to maintain peace and harmony in these difficult times for our state. APC and Dimapur in charge for COVID-19, Y. Kikheto Sema, today said that despite the existing SOP, returnees from other districts presently undergoing treatment and at quarantine centers will have to be sent to their respective districts if the intake capacity of Dimapur is full. Informing this at a press conference at Commissioner's Guest House, Dimapur today, Kikheto said that the existing Dimapur COVID-19 hospital is full and urged Peren and Mon authorities to cooperate since Dimapur will be sending patients whenever the capacity is full.
But since our hospitals are fully packed and very soon we will be left with no alternative but to send some of the asymptomatic patient to the respective district as per the SOP. I believe this is not a time that they should shy away the responsibility. And this is what I would like to convey to all the concerned. And also appealing to the people that, I was also shocked to see that some of the village GBs and the councils, they are given kind of, orders as if there is no government actually. I believe this is the time government should act as a government. We cannot allow NGO to be NGOs and GO to be NGOs, Government is instituted by God, and we are also here, anointed by God to be a leader or to manage the show. And we should not shy away, some village council passing the judgment as if they are ahead of government without visualizing that Village Council Act 1978, I believe. It was by the government, by the state government, it was constituted. So how the GBs or the councils or the authority can go beyond, the government, I think that is very unfortunate.
A total of 99 returnees from Gujarat and Maharashtra reached Kohima, who were received at the reception center at IG Stadium, Kohima today. Out of 99 returnees, which included 35 male and 64 female, were screened and sent to government quarantine facility centers at Kohima. On their arrival, the reception committee, led by its co-convener and ADC Kohima Litrong Latongpi Rutsa, along with medical team, received the returnees at the venue, who came in 6 NST buses from Dimapur. District Administration of Peren, along with medical department, police personnel, DPRO staff and JAC members, received 3 buses carrying 30 male and 38 female returnees who were stranded in the states of Gujarat and Maharashtra today at GHSS ground Jaluki. On arrival at the staging area, the returnees were screened, after which they were shifted to quarantine centers arranged at Peren new site. District administration also distributed beddings and other essential items to the returnees, including gift hampers by PBBB Peren. According to the Department of Health and Family Welfare, out of the total of 117 positive cases, 88 persons are at District Hospital Dimapur, 4 are at Assam Rifles Hospital Dimapur, 8 patients are presently undergoing treatment at NHAK Kohima, and 11 are at Chetema COVID Hospital. 1 patient is at Peren CHC Jaluki, while 5 patients are undergoing treatment at Twengsang District Hospital. The district-wise distribution of cases by domicile district are Kohima 7, Dimapur 15, Mokokchung 0, Phek 1, Zinapoto 1, Twengsang 8, Mon 23, Woka 5, Kifri 4, Longland 0 and Peren 63. According to the Health and Family Welfare Department, a total of 2,779 persons were screened today. A total of 4,732 cumulative number of samples were sent for tests and results for 3,518 have been received, out of which 127 have tested positive and 3,388 samples have tested negative. A total of 122 samples were sent after 3 p.m. yesterday till 3 p.m. today. Results for 1,212 samples are awaited. A total of 152 samples were tested by TrueNat and 114 have tested negative. 38 results are awaited. A total of 5,922 persons are presently under facility quarantine, while 7,870 persons are under home quarantine. That's all we have time for in this edition of News Broadcast. But before we leave you, here's a reminder that you can send us your videos at the WhatsApp number flashed below and be part of this venture of being a citizen journalist. Meanwhile, stay safe, practice safe health hygiene, and maintain social distancing wherever you are. And most importantly, take good care of yourself. From all of us here, it's bye for now, and thanks for watching.